So I was looking at your staffing page. There is someone on that staff whose specific title was investigative journalist, which I found fascinating.
Yeah.
What is she doing? What is investigative journalism under
Mhm.
MedShadow? Like, what is she actually doing?
So Emma was our lead reporter in the generics investigation that we did in this. And there is a depth of information there, uncovering information that is glossed over in a lot of health sites. So one of the things that she has been doing and has done this past year is really dig deep into what is concealed about RX medication. And so a lot of people we find have not thought about this, but they're blown away. When you pick up your RX bottle from your CVS or your Rite Aid or your Stop and Shop or whatever, look at the bottom of the bottle and it'll say something about the manufacturer. So the digging that she did, there's something called the Orange Book on the FDA site. And as you know, we're now hamstrung by the fact that every time we were turning around, the FDA was taking stuff down, dismantling really critical information, and sometimes putting up stuff that was just dead wrong. But what we've learned and through Emma's digging is that manufacturer is a mirage.
Hello, I'm Simon Owens, and this is The Business of Content, the show about how publishers create, distribute, and monetize their digital content. For decades, Diane Salvatore helped lead some of America's most recognizable magazine brands, including Consumer Reports, where rigorous product testing and consumer safety were core to the mission. Now, as the executive director of the MedShadow Foundation, she's applying that same watchdog mentality to one of the most opaque corners of the marketplace, prescription and over-the-counter drugs. In a recent interview, Diane walked through how MedShadow operates as a nonprofit investigative newsroom, its expansion into social media video, and its plan to build a donor-supported model that funds independent health journalism. If you want to listen to an audio version of this show, subscribe to The Business of Content wherever you get your podcasts. Okay, let's jump into the interview. Hey, Diane, thanks for joining us.
Hey, Simon, it's great to be here. Thanks for having me.
So I am super excited to talk to you because you have, a very traditional journalism background, and you've taken that journalism background and you've brought it into the nonprofit space for this organization that does journalism, does investigative journalism, but it's an advocacy organization. It's not what you would think of as a traditional media company. So I definitely want to dive into that. First, I just love to just hear about your background. I know were you an editor at Consumer Reports, or where were you before?
Yeah, I was actually a 4-time editor-in-chief, including at Consumer Reports, at Prevention, at Ladies Home Journal, and a teen magazine way before that. So yes, I've run big brands, and now here I am at MedShadow, which is a small but mighty website.
Yeah, and so I can't help but notice the kind of parallels between Consumer Reports and MedShadow in the sense of it, really focusing on product quality. Was that kind of a theme of your whole journalism career? You said Ladies Home Journal and stuff like that. Were you doing product reviews or testing there? Or yeah,
you're exactly right, Simon. The through line is that I've always believed and acted on the idea that journalism does seek to change the world and improve the world. So going all the way back to Ladies Home Journal, the kind of, I would say, advocacy that, I sort of led there was anything that had to do with improving the quality of American families' lives. And a lot of it had to do with health. That's the other through line for me. I've always been very, very committed to, health reporting, and that's been an area of keen interest. I was the editor-in-chief at Consumer Reports for 7.5 years. And so that, a lot of people don't realize Consumer Reports is a nonprofit. It's subscriber supported, and the evaluation of products really has to do with consumer safety. And that's the through line. So you're right. When you come to MedShadow, the consumer safety proposition about RX and OTC drugs that we consume, that's what we aim to illuminate, help people on a daily basis figure out how to protect themselves, but then use the investigative journalism to stimulate dialogue nationally with people who can change the broader system of protections or lack of protections that we're, all at the mercy of.
And with Consumer Reports, it's an old school magazine. Younger people listening or watching this might not be as familiar with it, but it was or maybe it still is, but obviously there's a lot of competition now with review,
Yeah.
like Wirecutter and review sites. Not that they do the exact same thing, but there's some
No,
overlap.
you're exactly right.
But it was the place, especially during the kind of pre-internet days, that people would subscribe to, where if they wanted to know the quality of a product, like Consumer Reports had like a very rigorous testing process, right? Like it's kind of whole bread and butter, right?
Yeah, that's still a unique, position that they have a massive set of labs that are staffed by scientists and techs, and they do deep, vigorous, long-term, testing of everything from your washing machine to your protein drinks. And you're right. I mean, going back to when I was there, the first competitor was Amazon, and then there was Wirecutter and Buyside and a million others. The trick, and I think I sympathize with this because it's something that everybody who interrogates any kind of product or drug is that you want people to understand why the rigor is important, why it's more important to have something scientifically interrogated, or in the case of MedShadow, to have our reporters look deeply at the clinical studies that were done. Was it 1,000 people or 4,000 people? Was it just on white men, and it should have been on people of color and more women, et cetera, et cetera? That rigor is just important, and more important than what your Aunt Sally in Ohio used recently and liked. I mean, knock yourself out. That's what you want. But if you are the person that wants deep research, and that is our audience, you want that kind of deep study and verification, then MedShadow's the place to come to.
Well, going back to Consumer Reports for a little bit, like at the height of its power,
yeah,
are there any famous stories of it taking down companies or things like that by finding that their claims were fraudulent or something like that? I just want to give viewers a sense of how influential it was at its height.
No, there are actually many. The Consumer Reports was, of course, very famous always for its car safety reporting, and there have been countless examples of lack of tire quality that caused crashes, the fact that back seats did not have adequate seat belts, that test dummies were not designed to be tested on women, and therefore restraints in cars, car seats. And there's just been a regular parade of warnings about products, a lot of baby products, these sleepers that resulted in babies being strangled. I mean, some of it is, just literally life-saving work that's done like that. And then there's, more bread and butter stuff. I mean, Consumer Reports routinely tested sunscreens. And this was illuminating because you would buy, the 75 SPF, and the Consumer Reports testing would show that there's actually only 60 or 40. And it was all about accountability, Simon, name the companies, do your homework, name the companies, go to the companies, hold them accountable. And, I'd say, again, that's something that I've come to believe in strongly. As you can imagine, with RX drugs and OTC drugs, the same accountability is required in order to not just protect you and me, but, get the whole marketplace to be safer. We have to name names and make people explain where the drugs are made, if they're not safe, if they're not effective.
Yeah, and I think Consumer Reports just had a blockbuster report on protein powders and showed that so many of them have lead and stuff like that in them. So you were there, in its more recent years. Mm-hmm. How did it fare? You mentioned Amazon, Wirecutter. How did it fare? Because I remember reading an article in the New York Times in the late 2000s, maybe early 2010s, that it actually was succeeding at digital subscriptions, but I don't know if that's what continued to be the case. How did it kind of adapt to the era when there are YouTubers and TikTokers constantly reviewing products and showing people the products and stuff like that?
Yeah, and I mean, obviously, I don't want to speak for them. I haven't been there in about 4 years, but I can tell you in the last years that I was there, it was a struggle to get subscriptions. Not unique to Consumer Reports, but digital subscriptions were expensive. They had a legacy audience that was used to the print product. I was there during, a massive reskin and rebranding of the famous ratings, which used to be black and red, I mean. And, you mentioned the influence of digital. It was very clear that everything, online, green was good and red was bad. And we were completely out in a different stratosphere. So even just something simple like that, an adjustment that had to be made to that reality. But, I think, Wirecutter's doing a kind of particular thing. One of the big threats from Wirecutter to Consumer Reports was that because Consumer Reports had such a high overhead with, technicians and a union, they had to always do big ticket items, refrigerators, cars, to make the ROI work. So there wasn't a lot of ability to do sneakers, they did do plenty of electronics, small stuff, but, Wirecutter is able to be more nimble because they're not carrying, a staff of 60 technicians. So they can, take 5 smart editors and say, try these smaller products. Bedding was another big one that Consumer Reports was famous for. And some of those mattresses, Simon, they used to ship to Germany because there was an outfit in Germany that had only this, they were the only ones that had this particular piece of machinery. And the question is, how do you make people appreciate the difference again in that scientific rigor to the tune of, a higher digital subscription price? I think that, at the time it was the beginning of Consumer Reports trying to personalize so that you could get, say recall notices for products that you owned, so that there was more, customization, personalization, a curation of your interests. And that was a path that they tried to win with.
Yeah. And now there are entire websites that do nothing but mattress testing because it's such a lucrative affiliate.
There's been an explosion of products, so everybody's desperate for a good night's sleep.
Yeah. Yeah. I mean, it's like a purchase you make once every 10 years or so. And it's a big purchase. So you started working at MedShadow when?
I'm here about a year and a half. So July of last year.
And what's your official title?
I'm the executive director. So I'm responsible for all of the nonprofit functionality of MedShadow in addition to the content side.
So the executive director is kind of like the CEO of a nonprofit.
That's right.
Yeah.
Mm-hmm.
Okay. So can you run me through briefly, like the history of MedShadow? Like from what I understand, it has like a big funder behind, like a single big funder behind it or something.
That's exactly right. So Suzanne Robati is our founder and president still. And she started MedShadow back in 2013. And her origin story is that she is what is called a DES daughter. So DES was a drug that was given to women from the 1950s to the 70s, ostensibly to prevent miscarriage. And not only was it not terribly effective at that, but come to find out that the drug caused some really serious problems in the children, the sons and daughters. Infertility is one of them, some cancers. And so, as you can imagine, this was a sort of a galvanizing experience for Sue Robati, as she, came into adulthood. And what
she was a child whose mother had taken the drug.
Exactly. So she's what's called a DES daughter. Yeah. And so there is also a DES Action USA website that she still maintains. But as we've gotten into DES grandchildren, a lot of there's virtually no new funding that's been approved for that drug. However, what she really the epiphany for her was that drugs were given to people without really adequate transparency, testing, follow-up, and real harm was done. And there needed to be a lot more transparency and accountability, from the pharmaceutical, companies as well as doctors who dispense these drugs, and that people deserve to know, and people deserved to know so that they could balance the benefit and the risk of any drug that they're taking. Obviously, DES was removed from the market because of of the fact that it would cause, really terrible side effects. But today, if you're given an RX drug, there are side effects that you will encounter, and it's a lot of times doctors aren't keen to talk about them. They want you to take the drug, so they're afraid of suggesting a side effect and so on. Or people feel gaslit. They suddenly have, a rash, and they don't even think that maybe it's from this drug. And don't get us wrong, Simon, Western medicine is a miracle. I mean, RX drugs have been lifesavers for millions and millions of people. We take them, on the MedShadow staff. But the idea is, and this springs from, Sue's legacy and still her leadership, that we deserve to know, and we want to help you because it's not easy. That's part of where the name comes from, Simon. Shadow, like these things are in the shadows, and we want to illuminate for people how to find this out. So Sue ran a very lean, staff, for all those many years, and it's still small.
Of the MedShadow Foundation.
Yeah.
When was it founded?
2013.
2013. Okay, so she found it, and she ran it for the first several years.
She ran it for a long time until she hired me. I'm the first executive director, so she was really doing everything.
And did it have a journalistic bent from the very beginning?
Yes. I mean, there were, definitely, journalists writing, and so that philosophically hasn't changed. I do feel that now, what I've brought to the table, along with my head of content, Jessica Di Giacinto, is, a really higher bar, clear standards, a higher quality writer, investigative reporters. We have a terrific senior investigative reporter on staff, Emma Yasinski, and we've just added a second one who's a PhD in chemistry. So, the kind of health journalism that we do requires a certain, higher level of rigor, frankly. And that's what we know that our users want and are interested in. So at the same time, we want to make it, accessible to people. We know we're not an academic journal.
So prior to you coming on, what kind of content was it creating, and what kind of journalism?
So it was still in the wheelhouse of what we do now. So balancing risks and benefits of RX and OTC. And it was, and it still is, also about integrative complementary health as well. Because if you look at this as in a bigger framework, Simon, the idea is that, philosophically, our position is, try to be on as few medications as you can. And so one of the things you want to do is start with a healthy lifestyle. And you also want choices. I mean, this is an audience segment we're learning a lot about, is that while, they don't shun Western treatments, they want to understand better, like, what about acupuncture and what about, herbal medicines? And, that kind of integrative medicine is not as well funded. It is, it's hard for those people to get research. And so then a lot of, research funding. And so a lot of times you'll read stories that say, well, there's no studies, but the fact is, some of these methodologies are thousands of years old. And so we have a panel we call HMAP, Health and Medical Advisory Panel, where we really try to have a spectrum of people who are integrative, Western MDs, DOs, PhDs, so that we can have a conversation. So, I mean, to your question though, Simon, the pieces that were done were, they were shorter, they were more reactive, they were more sort of strictly servicey. There wasn't, I would say, a really, really tightly carved out niche, so that the site was competing with a lot of other health websites like, WebMD and Healthline and that type of thing. And when you're a staff of, 4, you're not going to win at that, right? Because you can't produce 7 stories a day.
And back then, was there any original reporting, or was it just kind of like?
Oh no! It was all original reporting.
So it wasn't just like pulling like here's what the study said. It was what kind of original reporting is that? Like, is it like having people submit tips about side effects they're having, or like what kind of original reporting were they doing? And we'll then talk about what you're doing with the investigative journalism now, obviously, but back then.
Yeah, I mean, again. not having been there in 2013,
Yeah.
14, et cetera,
Yeah.
but, what I could see of what was, on the site, it was, it was on point in that it would talk about, new drug side effects or classes of drugs that were dangerous, or FDA, machinations about what they were and weren't doing, and, breaking news, in, integrative medicine. It was a bit of a grab bag, I guess I would say, Simon. You didn't get a strong point of view
Mhm.
necessarily. It was just a lot across the waterfront.
But like, were they like picking up the phone and calling sources, or like?
Yeah. No, it was actual bona fide, real journalists doing, real journalism. So,
And how
yeah.
much is historically the MedShadow Foundation like reliant on search, like Google search, like people they're about to take a drug, or they're thinking about taking I saw like on the top there's a recent article about like magnesium supplements and stuff like
Yeah.
that. They're thinking about taking magnesium supplements to sleep better, and they're Googling, like, is that a big portion of the audience?
So, I mean, it's a great question, and like everybody else in the digital space, MedShadow, before me was, on that roller coaster, that SEO roller coaster, and yeah, from what I understand and from what I hear, yes, there was a lot of trying to chase SEO, and then a lot of disappointment about that not working, and so, where we find ourselves today, Simon, is that I will not have us be a slave to SEO, because you can't win at that game anyway. It's all AI. Nobody's going to websites anyway. And so what I prioritized with the site remake was engagement. So yes, of course, people are searching for drugs. There's searching for side effects, et cetera, and they will find their way to us. But what I want is to get people who, again, don't just want like the, oh, what are the 6 side effects, to this new antibiotic, and like, I'm done, and they leave. These are people who are really committed to, putting in time and effort in their health and their, prevention of health and living longer, healthier. And so, we're fortunate to have a suite of RX drugs to choose from, but it's important to know, particularly, as you add more drugs to your diet, how they interact with each other. I'll also say, Simon, it's fascinating to me because I've been in a lot of big brands, as you know. MedShadow has equal numbers of users from every generation. So if sometimes people hear what we're about, and they assume that we're boomers plus, and we're not. We have tons of users 18 to 25, 26 to 44, because what we have seen is a huge population of interest in ADHD drugs and SSIRs, and those tend to be used by a younger cohort. So they're coming to us too. So if they come to us, what they're going to hear is not just like a list of side effects. They're going to hear a discussion of other people who are on these drugs. Are there variations in effectiveness of if you're taking a generic or you switch to a generic? What are the clinical trials really saying? Somebody who wants to really be deeply engaged and understand this at a deeper level.
And this is jumping ahead a little bit, but in terms of search engines, like, obviously most publishers don't like AI generated results because it gets them to not click on a link that can't be monetized. But since you're not monetizing clicks, are you thinking about, like, we want our information in those AI generated results because
Yeah.
we want those results to be more informed? Like, what are your thoughts kind of on that?
Yeah. No, you're exactly right. I mean, because I think, the work of this coming year is to really expand our footprint out in the digital space everywhere we can. We want to make sure that people begin to hear about MedShadow, understand who we are, become familiar with the brand name, and everything we do. So one of the results of the website relaunch has been that we're showing up in AI. Yeah, and you're exactly right. We're happy about that because we want to rise to the top of lists, whether it's traditional Google search or AI. You're right, because we are not making, we're not dependent on subscriptions to survive. Having said that, we do seek donations, and we see that as a way of a kind of proof of concept, Simon, that, we want people to feel that we want to see evidence that people have skin in the game, that they want to support the investigative journalism that we do. And it's worth saying, we don't take a dime. We don't take a dime from pharmaceutical or supplement companies. And even a lot of well-respected health sites do. I mean, I sympathize. People have to have, we're fortunate to have a founder who's, committed and is our main, donor. But, you asked me earlier, that was one of the things that disturbed Sue Rabati in the early days, was that when she went looking for information, and ADHD drugs were something she had a nephew who needed that. Everything she touched was sponsored by, a pharmaceutical company. And so how do you assure yourself that what you're getting is not, somebody doesn't have their finger, on the scale, or they haven't left something out because the pharmaceutical company, has an ad, on that particular newsletter. This is real. I mean, I know I worked at, ad supported brands, for a long time, and it goes on. So, and that's one of the things we've learned, that, from a recent brand study, a national brand study of 4,000 Americans that hadn't been done at MedShadow before, that our people, our tribe, the people that we want to get to, rank that as the number one thing. They want to get their information from a place they can trust. What accrues to trust? That you don't take money for pharmaceutical, and that you don't have a political agenda, which we also don't have, Simon. We are completely apolitical. This is hard to do today because every word in the English language somehow has become politicized. And there's a lot going on in the health space when it comes to politics, but we're not in a camp. We're not in a political camp. We're only showing up to really try to help individual people understand the effects of the drugs that they're on, and if they're on too many, how to responsibly get off them, how to work with your pharmacists. Pharmacists are a very underappreciated, massively expert resource available to us all. So we want to support them. And we would like to also see doctors and doctors are in a bad spot, right, Simon? Because they've got 7 minutes to see 14 patients every day, because they're owned by VCs. And yet, what's at stake here? The health of every single American, and we need many hands on deck to help people get the information that they need.
So when you were hired a year and a half ago, what was kind of the edict, the mission that you were given? Like, what could you do that the founder couldn't do? Like, did she want you to expand the newsroom or expand the capabilities? Like, what was kind of your
Sure. So there were a couple of things. I mean, one is that Sue herself, for a long time, was doing too many things. To be the founder and the board president, and running the board, and then running a newsroom and trying to raise donations and be an advocate and do some writing. And it was, way too much, And so she had come to a point in her life where she understood that she needed to have, a professional executive director. And the agreement that she and I struck, and that we still have today, is that, she remains the president of the board, but that she now can be positioned as our lead advocate. So, it was her brainchild to do this series on generic drugs and the lack of safety among generics. And we all worked on that the series of 3 webinars that were, it was a really heavy lift. It was, PhDs and scientists and talking about these really tough issues, but well worth doing. So she had the freedom to really be a thought leader, that way. And at the same time, I'm sure she would say this herself, she had not been, a senior editorial person in her career. And so she certainly wanted the newsroom professionalize the content to be made higher quality, and for us to get more, traction on the site so that people could see the value, that we brought. And so there was a lot of work, Simon, that I had to do last year that had nothing to do with journalism. That was just professionalizing the HR function and the public relations function, and, IT, and, processes. And, there was a lot to be done. But, content was equally important to me. And we now have, in fact, grown that content team, really honed what our point of view is. I was able to bring in, my top writers from, decades of working, and my new head of content has brought her people. And, we've done some, really, I think, unique stories. And we're not also afraid of length. I mean, we've got some 8,000 word pieces on, the state of HT, of, little known side effects of, cannabis. The kind of statins is like one of these things that's hiding in plain sight. Almost everybody in the world is on statins for life, and it's not questioned, and it should be. So again, sort of looking under the hood of some of these things that everybody kind of just takes for granted is where we find that we can bring value.
So let's talk about present day, like what you kind of built out. So like I was looking at your staffing page. There is like someone on that staff whose specific title was investigative journalist, which I found fascinating.
Yeah, that's Emma. Yeah.
What is she doing? Like you think of investigative journalism like stuff that's not like. I mean, I think this is somewhat incorrect when people think of this. Is like they think of like the spotlight, like someone who's going away for 6 months, and then coming back with like but like that's probably not what she's doing necessarily. Like maybe she's working on a project for 6 months, but she's probably also juggling that with other things. So like, what is investigative journalism under the rubric or under the under MedShadow? Like, what is she actually doing?
Yeah, so Emma was our lead reporter in the generics investigation, that we did, and there's, that's why you'll see it there as one of the main navigation things. And there is a depth of information there, Simon, that's not well reported. I mean, I will say, in fairness, ProPublica came on strong in the generic space, and they do a great job. And we I don't want to flatter us, they've got like 60 people or something like that, but that's what we aspire to, is uncovering information that is glossed over in a lot of, just once over lightly health sites. So one of the things that she has been doing and has done this past year is really dig deep into what is concealed about RX medication. And so a lot of people we find have not thought about this, but they're blown away. When you pick up your RX bottle from your CVS or your Rite Aid or your Stop and Shop or whatever, look at the bottom of the bottle and it'll say something, and I'll have something about the manufacturer. So the digging that she did, there's something called the Orange Book on the FDA site. And as you know, we're now hamstrung by the fact that every time we were turning around, the FDA was taking stuff down, dismantling, really critical information, and sometimes putting up stuff that was just dead wrong. But what we've learned, and through Emma's digging, is that manufacturer is a mirage, because it might be the name of a parent company, and then there's like 6 other companies in there, and one's in China, one's in India, and one's in Indiana. And it might be the company that has made the API, which is the actual active chemical, or it just might be the plant at which the capsule was assembled, or it might be the people who just made the capsule. And so, this is not commonly understood information. And so she then did a series of, TikToks. We included this in our, the generics webinar. So we had really like cross-channel explanation of this. And, some of her TikToks have gotten, 800,000, 700,000 views, because when people learn this, they are shocked. They're like, what do you mean? Like, Simon, where like our Oreo cookies are made. That's easy to find out. It's easy to find out what's in it. But your diabetes medication or, your osteoporosis medication, good luck if you're taking a generic. It's really hard to find out what manufacturing plant made the key ingredient. And what we know about the FDA, and this is work that Emma did too, digging into the files of how often does the FDA actually inspect these plants? Well, they've blown past their own standards, which is they haven't gone to a ton of these in more than 5 years. And when they do go, there's a lot of really kind of diabolical concealment that goes on, sometimes even fake plants that aren't where things are actually made, a second set of data. And so this is what she's surfaced. Do we have ambitions for her beyond that? Absolutely, and it's early days as far as this goes. But
And just like, so I understand this
yeah,
specific story, like, so the revelation from the thing is like when someone takes a generic drug, they think, oh, this is just the exact formula that Pfizer used originally or something like that. But you're saying that like maybe a bunch of like a shady company that maybe cuts corners or something like that with the manufacturing, and maybe is putting ingredients in there that we don't even know about or something like that. Like that could be happening, that there's not a lot of
yeah,
quality checks on that.
that's exactly right. There is the best estimates among experts is that what they call roughly a 13% failure rate. And that means that the generic either does not have enough of the chemical that it said that it's supposed to have to make it truly bio equivalent, or it has contaminants in it. Leads, arsenic is at the top of the list. A lot of these drugs have arsenic, or the dissolution mechanism is broken. Some drugs are made to be effective only if they, a drip, drip, drip of the ingredient, over the course of 24 hours. And if the dissolution like comes right out of the cannon all at once, it can actually kill you. There are other things. You might remember this from November of last year, a simple over-the-counter eye drop just for scratchy eyes, blinded people. I mean, I still am haunted by that one. Now, why is that? These are made at plants, some in the United States. Generics overwhelmingly are made overseas. The plants are not inspected. And, come to find out, Peter Baker was a swashbuckling, FDA inspector who was on one of our generics webinars. They're infested with, rats and, birds. There's, fungus in these. And yeah, people are operating under the false assurance that their generics are bioequivalent, safe, and effective. And, a 13% failure rate. I mean, would you buy a new car if I told you, well, the car that you're about to buy, you could be one of the 13% that the brakes won't work. You buy it, and yet we're all swallowing this stuff. Now, who's going to solve this? MedShadow wants to be, the place among others who are covering this to say, pay attention. Attention must be paid. We're going to try to tell you everything you can do to protect yourself right now. But we need many people to help solve this problem. The government, the private sector. There are companies like Valashore, who is on our panel, who wants to have testing ratings, not unlike Consumer Reports, Simon, right on the bottle. And remember, you're right. Cost is the name of the game here. There's a race to the bottom. Why do companies do this? Because if they can leave out an ingredient or sneak in something that's lower quality, and no one holds them accountable, and they'll save money, and they can charge less, and therefore they will be chosen by your insurance company, people do it.
So this investigative journalist, like, is she calling up anonymous sources? Is she setting up a tip line? Like, what's kind of the meat of her reporting process?
Yeah. So the meat of the reporting started, in the traditional way, like getting to, a whole panoply of experts in this field, researchers, PhDs, clinical chemists, people who don't always get their day in court, if it will, people aren't calling them up, because But and then there's again, as I say, these databases, the FDA databases, just rich with information. um, and then I think also this is one of the hallmarks that we want to have at MedShadow is inviting real people to comment. And when she started doing the TikToks, which was new last year, I mean literally tens of thousands of people showed up and said, you know, I keep track. I had generic A this month. I had generic B this month, and another yet another one. And I can tell because I don't feel the same. I can't concentrate, or I'm depressed. I couldn't get out of bed, and then suddenly I get a new generic, and it works okay. And people feel gaslit. So I mean, I don't know if you necessarily want to call that investigative reporting, but it's comprehensive reporting to pull people who are having their lived experience into the reporting and treat it with seriousness. I mean, it reminds you a lot of the stuff that, when you hear about contamination in these small towns and people say the cows are dying and everybody's kind of like, well, I don't know, maybe, maybe you have the validation of people's lived experience is part of what we're doing to surface these problems.
So we'll talk about the video stuff in a second, but like in terms of like just the website and the articles that are going on the website, what's kind of like the content production output on a weekly basis?
Yeah, so we try to have 3 or 4 stories, a month at a bare minimum, and we're trying to up that. It's for us, again, it's less of a volume game than it is about, deeply reported, pieces that will be, satisfying. But we have a number of destination columns that are doing extremely well, like the FDA updates and recalls. We have another destination column called, can I take this with that? Because, somebody gets a new RX, but they were taking, these other supplements, and, interactions can like really do a number on you, and people really respond to that, like really understanding. And we're going to be making those searchable database too, Simon, soon.
And a lot of nonprofit media organizations I talk to, they try to partner with media companies, all like traditional media companies all the way, like in terms of like sometimes co-reporting, but a lot of times just distribution, like saying this is under a Creative Commons license or whatever, so that you can take this article and run it on your website and stuff like that. Do you do anything along those lines?
Yeah. We have a reprint our stories, please tab. We and I mean, I agree with you, Simon, that there's a need. I mean, one job that I had before coming here was at Lee Enterprises, which was, 70 mid-sized newspapers. And as you know, those newsrooms are being slashed to smithereens, and they just don't have the bodies. And so we would be very open to a kind of, syndication play with a group like that, or somebody because we're interested in getting the word out. So any vehicle that we can use for that. But yeah, we want to call attention to the fact that you can reprint our story without paying us. Just please credit us and link back to the site.
Is there any kind of formal outreach to editors at like publications and stuff like that?
It's in the works, it's, one of the things that we would like to find, more time to do, frankly.
So you have the investigative journalists are like most of the 3 to 4 articles per month, like are those like staff writers, or are they contractors?
No, we have an army of freelancers, and, people who, like I say, I've worked with in past lives, Knight fellows and people who are really distinguished award-winning folks, and so we'll have we have 2 or 3 months of 4 months of stories in the works, and we added our second second reporter, the PhD chemist. Crystal Chandra is her name, and she's now, it's just really we're just fortunate to have, investment in staff, So we've got the 2 part-time staff reporters and our army of freelancers, and the investments that Sue has greenlighted, year over year. A lot of it, Simon, went to staff and to content dollars. And, that's something I asked for. It's something that Sue supported, and it's really what makes the difference.
And the chemist, is she just bringing her expertise into the reporting, or is she actually doing like lab testing or anything like that?
She's not doing lab testing, but we do want to be in that space more, a deeper interrogation of actual, product stuff. So that's to come. I mean, and also to say she has a degree in science communication. So, I don't want to characterize her as, like a bench chemist. She's, a terrific writer too. And that's that's kind of like our unique space is, people who can write authoritatively but compellingly about these issues that are, that do involve, chemistry and, what we talk about is, the way that chemistry interacts with the human body and deeply understanding that. And, we see how hard it is to get that information as a medical consumer from anybody. So, we want to be a place where people can come to really, deeply interrogate that and, and then make an informed decision. And that's all we can ask for. I want to be clear. Like, we're not saying don't take medication. You need medication. It's life-saving, but understand what choices you're making and why. Maybe you don't want to take the newest drug that hit the market because we're here to tell you that the clinical study was only done on 400 people. Maybe you want an older drug, but sometimes older drugs are exclusively made as generics, and then the generics are not great. So, there's more layers to making a conscious choice about what drug to take than a lot of people realize. But the people who do realize it, come to us, and that's, we're gratified to see that more of them are coming since we launched the new site.
So let's talk about like TikTok. You also have an Instagram page, so it's not as popular as the TikTok. It looks like.
Yeah.
It's it looked, I watched a few videos. Like, it's definitely, someone who knows what they're doing. It's like you have someone a young person on your staff who has the green screen behind her where she's pointing up to articles or images and stuff like that. Yeah, and speaking in a very conversational tone that's like, and you see a lot of health content on like short form video of like, did you know that you could, because I watch a lot of fitness stuff and like, so people like, it's got that, it's got a very specific like tone that is, if anyone who watches any kind of health content on TikTok, whether it's actually good health content, and obviously there's a lot of bad in there.
Yeah.
So like, that's kind of like, you talk about a lot of people coming in through Google where they're specifically searching out, whereas TikTok's more of a push platform where it's like, people scrolling through and seeing this content out there. I guess just talk about like about that. Like, is that a major push of yours, is to try to move into these more kind of algorithmic, like entertaining platforms?
Yeah, I mean, absolutely. I mean, there were a lot of initiatives last year, but social media was at the top of the list. And, I knew that we needed to be where people were, and that's where people are. And so, it's interesting because, while Emma had dabbled in TikTok before, she hadn't sort of been given the framework and the, permission to sort of go at it whole hog. And, we really didn't know if she was going to like it or it was going to work. And I mean, she just really took to it, like, a fish to water. And what I love about her TikTok, Simon, is that, it's an authentic delivery. I mean, if you met Emma in person, she's exactly like that. There's no like, artifice in that. She's deeply committed to the fact. She gives it to you the way it is. And she feels a sense of urgency about helping to get, people educated about this stuff. And, you're right. I mean, when I got here, we had like, something like 11,000 views on TikTok. And, we peaked last year at 1.8 million. One of which was the 1.5 million views on a recall, which, is an important one. But, to be in the fortunate position of hiring today, Simon, this is not news, but you really feel the weight of that when you're hiring a journalist today. You want to try to get people who are comfortable across channels. So it's not just, the ability to write a deep piece, but, can you essentially promote it, in video, and video is the currency. So, of digital in so many ways. So to be able to deliver it that way becomes, really important. So we're really gratified by that. She, we've worked out a way that she builds it right into her, her workflow, that she knows when she writes it that there's going to be a TikTok that goes with it, and it's going to be promoted in our newsletters. It'll probably be a webinar. We try to get many bites out of the one piece of reporting.
So obviously with drugs, like the FDA, ideally the drug company has done lots of testing on a large group of people prior to do it, but it's not until you really get it out into the population that you really truly get to see the side effects. And probably a lot of famous cases, it wasn't like you kind of needed that kind of mass distribution, unfortunately, to, some of the problems to start creeping up. Like what processes or if any do you have in place to like try to interact with your audience or crowdsource or anything like that, so that maybe MedShadow could be among the first to start learning that there's some kind of bad side effect or something like that we don't know about? Or do you do anything along those lines of like trying to interact directly with your audience or solicit information from them, stuff like that?
Yeah, I mean, absolutely, and again, more to come. But yeah, I mean, the ADHD community and the SSIR community showed up immediately in like tens of thousands with comments and questions, onto TikTok. And Emma has, again, been terrific about responding to them and asking if they'd be, willing to be interviewed in more detail, so that we can become a place where people can, share those stories. So, in terms of really understanding, the actual, I mean, the FDA clinical trials on drugs are not as great always as people would like to believe. There's an absence of testing on women in general. Pregnant women are never tested on. Older people are hardly ever tested on. There's still a lack of diversity in clinical testing. So that's part of what we want to explain to people, that you have to kind of understand, to your point, Simon, you're kind of part of the experiment if the drug is new. And so, one of our sort of calls to action is to encourage people to use the FDA site where you report side effects, and to tell your doctor to report the side effects there, because, obviously, at scale, we need everybody across the nation, and that's where it is. A lot of people don't think to do that. So I think we feel we can be of service if we tell people, keep track if you're on a new drug, keep track if you're on a new generic of the same drug that you were on, and report the side effects, because that's going to get the entire medical industrial complex aware of side effects at scale.
So you don't have like a generic call to action or tip line that's like just can just write you and say, I took this drug and something weird is happening.
Yeah, totally. I mean, we're embedding those in stories where we feel that, it's relevant. But I mean, I think we probably could do more of that, as, just have it be, a sort of standing link, out there.
Yeah. I noticed like ProPublica like very often has like calls to action of like, have you been impacted by this, whatever this thing is? Like here's an email, the email, stuff like that.
Exactly. Yeah. Yeah. No, we definitely have, email, emails for people to use to speak to us and tell us your story. We have a tell us your story tab, but, we want to do more of embedding it in the stories. And, it also, I think the commenting tool, I have high hopes for it. We actually built the commenting tool on the news site, very similar to what the New York Times has. And I confess, I have deep envy of, the Times has like 1,000 people on a story, and there's a conversation then between, other users and the reporter. And that's what we aspire to. I mean, to the point that you're making about how do we make MedShadow a place where there can be a robust conversation among the users with each other and with us about what they're experiencing. And so, we hope to really wake up that commenting functionality, so that we can have that be the interface with the audience.
So in terms of donations, like it sounds like it's still heavily reliant on this one person. How are you thinking about your audience in terms of funneling getting them engaged and taking them to that next level to turn them into donors or
Yeah.
members or anything like that? Is it only, do you
Yeah.
only allow one-off donations? Do you have a membership? Like, what do you do?
Yeah. So we're trying a dozen things this year on that front. We've talked about a membership model, but I'm not sure that we need to do that yet. But what we have our newly rebranded weekly wrap up Friday newsletter, and then we have a new newsletter on Substack called Meet Me at the Med Cart, which is about all things pharmacy related. And what we're experimenting with and rolling out this year is, what can we gate? What can we gate in terms of content on the Substack? What can we do, like 6-week pop-ups, native to MedShadow that would be, donation only. We're going to be doing more webinars this year on a variety of topics, and we're going to start charging for those. We're going to offer, say, exclusive interactions, one-on-one interactions with some of our health and medical advisors, say a pharmacist or one of the integrative doctors. If you donate $100, one of the people who donated $100 will be selected to have a 45-minute exclusive session. So something that we can offer that is of value and is exclusive and that would be hard for them to get anyplace else. We are experimenting with the language of our call to actions, with the topics. We have about a dozen topics that we believe are things that will change the marketplace, including what we talked about before, like, shouldn't your RX bottle tell you the truth and more of the truth about the pill that you're taking? So is there a petition attached to that that we can get people to sign on for? And what we've learned about the language experimentation, again, is that people do value reporting that is not sponsored by the pharmaceutical companies. And so what we say to them is, did you learn something from this investigation? If so, fund us so that we can do more. And, a lot of, independent journalism shops do that, but that's the company that we're in. People who understand that this kind of reporting isn't cheap, it isn't free, and if you want it to be independent, we need you to step up and support it.
Are there goals for like small donors? Like, is the goal that a lot of nonprofit media companies like that I talk to, they start out with large donors, but they start they have these future projections that they want to have X% of their budget covered by small donations by a certain date or something like that. Do you have anything like that?
So I'm in the middle of recruiting for a senior fundraiser. And so that will be the task, for that person. I have ideas about it now, but we need a much more, well-articulated program. And I look forward to having that going forward. What I can tell you is that we're not starting with large donors because we believe that there's a lot of energy around, the smaller donors, and that would be, proof of concept. And I think we have a ton of headroom there. I think that, hasn't quite been an organized, kind of relentless program. And that's what's now been put in place. And, I've also been able to hire a digital marketing firm who's terrific, who's helping us with all of those efforts too. So it's the work in front of us for this year and of course into next year as well.
So that person will be in charge of helping you with figure out how to get more small donors, courting kind of rich donors and trying to get them to give money.
Yeah, the rich donors are probably down the line into next year. But, there are things that we want to do around contests, there's a terrific, journalism schools all around the country. And, I my heart breaks for these students, Simon, and these graduates, because there's fewer and fewer jobs, and there are fewer and fewer jobs that are, the real kind of noble reporting that a lot of these students and people on my staff have always wanted to do. And so we want to see if we can help to support them as well by having, internships and, call attention, to the fact that, that there is a place for this kind of reporting still, and we're one of those places. So, competitions of that sort, we're hoping we could get sponsorships for that, for the contests, and then have some money left over to give, to the student winners. But again, also all of that is just like raising our brand awareness, right? Getting the word out. If you do a contest with 10 journalism schools around the country, you hope that now the MedShadow name becomes something in circulation among that younger, critical, journalistic student population. So.
And then what about grant writing? Like, is there a foundational opportunity?
Yeah, that again will be, it's on my map for next year. Grants are, they're a tough business. It's a super specialized skill. You can almost never find someone who does grant writing extremely well and then, one or two other things. So it's almost like I was at a New York Council on Nonprofit meeting last fall, and, people talked about, for nonprofits, a lot of different creative ways about how to fund that. Some of them did grant staff sharing. Again, because it's so specialized, very few people can afford to hire a whole body to do it. But it's a complete and colossal waste of time unless you have somebody who is excellent at it, who understands, how to search, in this ocean of what is exactly the grant that might speak to you, and then, fill out 70 pages, of a document. I mean, it's a huge time commitment. So, we want to wait till we have some other, basic needs fulfilled before we try to figure that one out.
And then, when you look on the horizon, you talked about some of the stuff you want to do, but when you look 2 years from now, you have a staff of a few reporters now. What do you want to be doing 2 years from now that you're not doing now?
We want to be doing more of the advocacy outreach of the journalism. I think that's what's really unique about MedShadow and attractive to me and my staff, that we can explicitly say that our investigative reporting is in the service of starting this public conversation and having the public scrutinize and bring people together to make solutions. So we want to be, we're a 501(c)(3), we're allowed to do advocacy. It's not, lobbying, but we want to be talking to legislators. In DC, we want to be talking to, private business people who have great ideas.
So you want to have a lobbyist?
So it's advocacy, and that's allowed. And, like I say, at Consumer Reports, to go back to that, Consumer Reports often testified in front of Congress, congressional committees with proprietary research that they had done. So yeah, that's in my head, because what you want is for the journalistic insights that have resulted to make tangible change in the world. That's going to help, you and me as individuals, but the whole process overall to have, medication be safer overall. And, if you're, an ad-supported, subscriber-supported media outlet, you don't really get to lead with your advocacy intentions, and we can. It's one of the reasons that this new site is constructed that way. Simon, we've got the first module is all of our great reporting, but the very second one is our advocacy, and here's our programs, and here's what we want to push for in the marketplace to make the marketplace safer. So we have that dual mandate. I think it's really special, and I think it's needed today in the world.
Okay, Diane, that's all the questions I have for you. Where can people find you online?
We are at medshadow.org. Please check us out.
Awesome. Well, this is a lot of fun. Thanks for joining me.
Thank you, Simon. Thanks for being interested.